I'm about to show you something that most heart patients never hear from their doctor. Not a pill, not a surgery, not a supplement, a simple daily meal that helps your body remove cholesterol from artery walls naturally and supports healthier, more flexible blood vessels. And the reason this matters is because after 20 years working with cardiac patients, I've seen something most people never see. I've seen the inside of arteries. I've seen vessels so stiff and calcified they felt like bone. I've seen plaque build up year after year until blood could barely pass through. And I've seen people who thought they were doing everything right still end up needing bypass surgery. And here's the part that shocked me the most. Most of what we're told about cleaning arteries is completely wrong. Lemon water won't dissolve plaque. Vinegar won't scrub your vessels. Garlic capsules don't magically melt cholesterol. Your arteries are not kitchen pipes. And plaque is not grease, so pouring natural remedies on top of it doesn't work, because plaque isn't a clog. It's inflammation. It's biology. It's your immune system reacting to damage inside the vessel wall. And until you understand that, nothing you try will truly help. What plaque really is, the part no one explains, imagine the inside lining of your artery like smooth Teflon, healthy, slippery, flexible. This lining, called the endothelium, releases nitric oxide, which keeps blood flowing easily and prevents cells from sticking. But over time, high blood pressure, high blood sugar, smoking, chronic stress, processed foods, all of this damages that lining. Tiny cracks form, and through those cracks, LDL cholesterol slips inside the wall. Now here's the critical part most people miss. LDL by itself isn't the real problem. Oxidized LDL is. When LDL gets trapped, it rusts, just like metal rusts in air. Your immune system sees that oxidized cholesterol and thinks, this is dangerous, attack it. So white blood cells rush in, they swallow the cholesterol, but they can't process all of it. So they swell up, turn into what scientists call foam cells, and pile up inside the artery wall. That pile becomes plaque. Not fat, not grease, but inflamed immune cells full of trapped cholesterol. That's why heart disease is really an inflammatory disease, not just a cholesterol problem. And here's what makes it dangerous. Most heart attacks don't happen because an artery slowly closes. They happen because plaque suddenly ruptures, forms a clot, and blocks blood flow in minutes. Which means even moderate plaque can be risky. Even 30–40% blockage can be dangerous. So just widening arteries with stents doesn't fix the real issue. You have to address what's happening inside the vessel wall. The breakthrough most people never hear about. Your body actually has a built-in cleanup system. It's called reverse cholesterol transport, and it's one of the most important protective mechanisms you have. This is where HDL, the so-called good cholesterol, acts like a garbage truck. It pulls cholesterol out of artery walls, carries it back to the liver, and your body removes it. In other words, your body already knows how to clean your arteries. It just needs the right signals to turn that system on. And here's the fascinating part. Certain foods, not drugs, have been shown to support nitric oxide production, reduce LDL oxidation, improve HDL function, support healthier calcium balance in arteries, and enhance this cholesterol removal pathway, not because they're superfoods, but because they contain specific bioactive compounds that affect real cellular pathways. This isn't wellness hype, this is physiology. And once I started seeing the research and watching what happened to patients who changed their diet strategically, I realized something. Food isn't just calories. Food is information. It tells your genes what to do. And if you give your body the right signals, it can start repairing itself. In the next part, I'm going to walk you through the exact 4 components of the meal, why each one targets a different mechanism, and how they work together like a protocol. Not just a salad component 1, nitrate-rich greens, nitric oxide boost. Let's start with the first piece of the protocol. And honestly, this might be the most underrated molecule in all of cardiovascular health, nitric oxide. This tiny gas controls something absolutely critical, how wide your blood vessels are. When nitric oxide is high, your arteries relax, blood flows easily, pressure drops, inflammation decreases, and plaque progression slows. When nitric oxide is low, your vessels constrict, blood flow decreases. Blood pressure rises, damage accelerates, and guess what happens naturally as we age? Nitric oxide production drops, hard, which means after 50 or 60, Most people are walking around with chronically stiff, constricted arteries, not because they're old, but because their nitric oxide system isn't supported. Here's the cool part. Your body can make nitric oxide two ways. The first is inside your arteries. The second, through food, specifically nitrate-rich vegetables. When you eat foods like arugula, beets, spinach, leafy greens, your body converts natural nitrates into nitric oxide through something called the enterosalivary pathway. It's one of the most elegant systems in human biology. You eat the greens, nitrate enters your blood, your saliva concentrates it, bacteria in your mouth convert it, and your body turns it into nitric oxide within hours. Studies show lower blood pressure, improved endothelial function, better blood flow, reduced arterial stiffness, all from simple greens, not drugs, not supplements, food. So this meal starts with 2 to 3 cups of raw arugula or mixed nitrate-rich greens. Raw matters. Cooking reduces nitrates. Eat them fresh. But there's one important rule most people never hear. If you use antiseptic mouthwash daily, you destroy the bacteria that make this pathway work, which means no bacteria, no conversion, no nitric oxide. So if you want this protocol to work, skip the mouthwash. Brush and floss. That's enough. Component 2. High phenolic extra virgin olive oil, cholesterol removal. Now we move to the part that surprises almost everyone. Fat. Yes, fat. For 40 years we were told, eat low fat for your heart. But here's what actually happened. HDL dropped, triglycerides increased, inflammation increased. Heart disease stayed number 1, because low-fat diets often remove the very compounds your arteries need. And one of the most powerful of those compounds is found in high-quality olive oil. Not generic oil, not vegetable oil, not light olive oil, real extra virgin olive oil rich in polyphenols. Especially one compound called oleocanthal. This compound does 2 huge things. First, it reduces inflammation. It acts similarly to natural ibuprofen. Second, and this is the exciting part, it helps activate the cholesterol export system we talked about earlier, the HDL cleanup pathway. Think of it like flipping the switch that tells your cells, okay, time to unload cholesterol. This is one reason the pre-dimed study showed something remarkable. People following a Mediterranean pattern with generous olive oil had about 30% fewer heart attacks and strokes compared to low-fat diets. 30% from food. So for this protocol, 3 or 4 tablespoons of high phenolic extra virgin olive oil daily. Yes, that sounds like a lot, but remember, this isn't extra calories. This is therapy. Pour it over the salad generously. If it tastes slightly peppery or burns the back of your throat, that's good. That means it's rich in polyphenols. That burn? That's the medicine. Component 3, vitamin K2, artery calcification control. Now let's talk about something most cardiologists barely mention. Calcium, because cholesterol isn't the only issue. Over time, plaque can harden. Calcium deposits form. Arteries literally become stiff like bone. This is what shows up on a calcium score scan. And here's the twist. Calcium itself isn't bad. It's just going to the wrong place. You want calcium in your bones, not your arteries. And the traffic controller for that process is vitamin K2. K2 activates proteins that help keep calcium out of soft tissues and direct it into bone. Without enough K2, calcium can deposit where you don't want it, including arteries. Unfortunately, most modern diets are low in K2. It's mainly found in fermented or aged foods, like natto, aged Gouda, certain cheeses, or MK7 supplements. So for this protocol, choose one. Small serving of natto, aged cheese, or a K2 supplement, MK7 form. This helps support flexible, healthy vessels over time. Think of it like maintenance, keeping pipes soft instead of turning into concrete. Component 4, pomegranate oxidation protection. Now we handle the trigger that starts plaque in the first place. Oxidation. Remember earlier? LDL isn't the problem. Oxidized LDL is. So what if you could reduce how easily LDL oxidizes? You interrupt the entire cascade. That's where pomegranate shines. It contains powerful polyphenols that reduce oxidative stress, support HDL function, protect LDL particles, lower inflammation markers. Human studies have even shown improvements in carotid artery thickness over time. So we add 1 cup fresh pomegranate seeds, not juice, whole seeds. Less sugar, more fiber, more polyphenols. Plus, It actually tastes amazing with olive oil and arugula. Sweet, peppery, rich. It turns this from health food into real food. Putting it all together, here's the full protocol meal. Large bowl, 2-3 cups arugula, 1 cup pomegranate seeds, 3-4 TBSP high phenolic olive oil K2 source on the side. That's it. 4 components, 4 mechanisms. Better blood flow, less oxidation, improved cholesterol transport, healthier calcium balance, all working together. Not magic, just biology. In the next part, I'll explain how often to eat it, how to actually use this meal, timing plus routine. All right, now you know the science, you know the 4 mechanisms, you know the 4 ingredients. But here's where most people fail. Not knowledge, consistency. Because none of this works if you do it sometimes. This isn't a superfood trend, this isn't a detox, this isn't something you try for a week. This works the same way medication works. Daily, repeated, predictable. So here's exactly how to use it. Timing. Eat this meal once per day, preferably lunch or early afternoon. Why? Because nitric oxide production peaks 2 to 3 hours after eating nitrates. So if you eat it at lunch, blood flow improves during your most active hours. Your heart gets better circulation, your exercise tolerance improves, your vessels stay relaxed during the day. Dinner is fine too. But pick one time and keep it consistent. Your body loves rhythm. Preparation, simple on purpose. This should not feel complicated. If it takes more than 10 minutes, you're overthinking it. Here's the routine. Big bowl, arugula, pomegranate seeds, olive oil. Add your K2 source toss. Eat slowly. Chew well. Done. No blender, no powders, no fancy recipes. Simple is sustainable, and sustainable is what heals arteries. The biggest mistakes that cancel the benefits. Now listen carefully, because these mistakes can quietly ruin everything, and most people never realize why healthy eating didn't work. Mistake number 1, using mouthwash daily. We already talked about this, but it's so important I'm repeating it. Antiseptic mouthwash kills the exact bacteria that help convert nitrates into nitric oxide. No bacteria, no nitric oxide, no benefit. Brush. Floss. Skip the antiseptic rinse. Mistake number 2, cheap olive oil. This one is huge. Most supermarket olive oil isn't what you think. It's old, refined, low polyphenol, sometimes diluted with seed oils. That's just fat, not therapy. You need extra virgin, cold-pressed, dark glass, fresh harvest. If it tastes peppery or makes you cough slightly, perfect. That sensation means it's rich in protective compounds. If it tastes flat and mild, it won't do much. Quality matters more than quantity. Mistake number 3, doing the salad, then eating junk all day. Let me be honest with you. You cannot out-salad a bad diet. If you eat this meal, then go eat fast food, sugar, refined carbs, fried seed oils. You're fighting yourself. This meal is the foundation, but the rest of your day should still look like whole foods, vegetables, fish, legumes, nuts, healthy fats. Think Mediterranean pattern, not salad plus drive-through. Mistake number 4, expecting instant results. This is not a 7-day cleanse. Plaque forms over decades. It doesn't disappear in a week. What you're doing is lowering inflammation, improving endothelial function, supporting healthy cholesterol transport, slowing progression, sometimes gradually regressing buildup. This is months, not days. Patience is part of the protocol. How do you know it's working? Monitoring. Here's something I always tell people: don't guess, measure. Because I feel fine is how heart disease sneaks up on you. Use objective data. Track these. 1. Blood pressure. At home. Few times per week. You should often see slightly lower numbers, better stability. 2. Lipid panel talk with your doctor about LDL, HDL, triglycerides, ApoB if available. You want higher HDL, lower triglycerides, better overall ratios. 3. Inflammation markers, like high sensitivity, CRP. Lower inflammation, you will calmer arteries. 4. Imaging, if recommended by your physician. Some people use calcium scoring or ultrasound tracking over time. Not yearly for everyone, but for higher risk individuals, it can be helpful. The key idea: let the data guide you. Not fear, not internet myths, not guesswork. A quick reality check. Let's zoom out for a second, because I want you to hear this clearly. There is no single magical food. There is no miracle ingredient, and nobody can promise to cure anything. But we can support the biology your body already has. Your body already knows how to repair vessels, move cholesterol, control inflammation, protect arteries. It just needs the right environment, and this meal creates that environment every single day. Small inputs, big long-term outcomes, the big picture, motivational close. If you're over 50 or 60, this isn't about dieting. This isn't about looking lean. This is about staying independent, avoiding hospital beds, avoiding procedures, having energy, playing with grandkids, walking without chest pain, living longer, but more importantly, living better. And sometimes, it starts with something as simple as what's on your plate today. One bowl, one meal, one habit repeated daily. That's how health is built, not dramatically, quietly, consistently. If this helped you understand your heart and arteries better, like the video, comment your questions. Subscribe for more science-based health breakdowns, because the goal here is simple. Less fear, more clarity, smarter daily choices. Take care of your arteries, and I'll see you in the next video.